this, you can introduce yourselves, but just to say where this kind of came from, I guess the connection was, this was when we had our BeSST conference and we were chatting about what you were doing in Dundee and the community practical, I guess, that's one of the terms that we use for it, but the community engagement and the community experience that the students are getting. And just thought it sounded so fantastic that we would love to hear about it. And I do know that there's lots of other people in BeSST that were really keen to find out more. It's just we pick a time and it's just a time that suits the presenters and it's impossible to get times that suit everybody, especially when it's busy teaching terms. So I think there'll be lots of people that will watch the recording of this with interest. So over to you to introduce yourselves and to tell us all about it.
Thank you very much. Yep, I had a great time at the kind of conference for BeSST back in June and came away really enthused and thought this would be a nice way of sharing what we're doing. So my name's Jordan. I work in the University of Dundee Medical School with my staff development hat on 4 days a week and 1 day a week a healthcare improvement hat on, which involves these community placements. And it's with that hat on that I'm here this afternoon. And I've got my colleague Carolyn with me.
Hello, I'm Carolyn Tipton. My background is in general practice clinically, but I now work with the Meds of the Elderly team in Dundee. And over about the last 10, 11 years, I've been involved with medical school in different guises. Over the last 4 or 5 years, having been given a role under the sort of general umbrella of global citizenship, we have been developing or looking at the part of global citizenship which comes under community engagement, just thinking about how we can engage students with the community. And it has sort of grown and developed as these placements that we're going to speak about today.
So our plan for what we'll cover in the talk is what we do, how we do it, and why we do it that way. I like simple structure to keep us right. So that's what we'll aim to cover. But we've got time at the end for a bit of a discussion, and we can answer questions. I pulled this quote out from something that a student had said to us. I think it was last year, saying that you learn what really matters to people without clinical goggles on. And for me, being a non-medical interloper in a medical school, I love to hear this stuff. I like it when they realise that actually there's important learning that happens that is non-clinical learning. And I think that's one of the key things that we see the students getting out of this. They realise that their role in medicine is going to be serving people, and it's not about them being a doctor and other people being patients. It's about kind of stripping that back a little bit and getting back to basics. I'm going to hand over to Carolyn for this bit.
I don't know if you can see this quote, but you might know it anyway. It says, wherever the art of medicine is loved, there is also a love of humanity. And it was really when we were doing the placements last summer. And if we keep walking past it, it's on one of the pillars on the way to one of the teaching rooms where we work. And it just struck me and sort of got my mind thinking about what does that mean and how do we teach the love of the students to love the art of medicine. I think it is very integral in this idea of just understanding more people and understanding people where they're at and not necessarily when they're playing their patient role. But how do we do that? But that's what we're trying to do through these placements that we call community engagement placements. I think this also fits under both the University of Dundee and the medical school sort of vision statements, which encompass this phrase of social purpose. And again, it's about what does that mean and how do we engage the students with the community? What do they learn from that? How does that impact them in the clinicians that they're going to become? We do it through the pedagogy, I'm never quite sure how you say the word, for service learning, which is much bigger in American medical schools. A lot of the American medical schools, it's compulsory, and a lot of the literature, the research literature is all from American medical schools, but this is the definition that is commonly used. There's 3 parts to it that we've tried to highlight there. So service learning is a credit-bearing educational experience in which students participate in an organised service activity that meets identified community needs and reflect on the service activity. So it is very much about the learning, but it's also about engaging with the community and thinking about how to meet something that they have identified as a need. But then a big part of this is the reflection. And there are, if you look through the literature, there are people now discussing whether this might be a way of helping students meet the ever-changing needs of the society that they are now going to be working in. And I think you will be more au fait with this from thinking about it from a sociology point of view than us. When you think about service learning, the idea is to think of it as its own identity. And it isn't just asking the students to go and volunteer. Neither is it asking them to go and just stand around and watch. It is its own identity, in that what we are asking is that the students take who they are, what they've already gained as medical students and from their life experience, to a third sector situation, work with that third situation to identify some sort of a need or something that they might be able to work on as a project during the placement. The placements are 4 weeks long. And then combine the experience is that they have to come up with some piece of work that will bring some sort of positive impact back to either the organisation itself or the service users. But in doing that, the student themselves will also learn. So if you have a look in the literature, they speak about this purple sphere because it's something new that comes from being involved in the community, not just volunteering and not just learning. I think the next one gives you this idea as well, that if they were just there watching and observing, then they would just be learning, and it's really just them that's getting something out of it. You could argue the other end of the scale is if they're volunteering, they might get something out of it, but on the whole, the greatest benefit goes to those that they are serving. Whereas what we're looking for is something in the middle of that, where they are serving, but they're also learning, and they gain, the service users gain, and the organisation gains. As we have been thinking about really why we're doing these placements and how is this relevant to studying medicine, then of course we come back to the GMC outcomes for doctors. And as you go through this, you can identify learning outcomes in all the 3 sections, from the provisional values and behaviours, the skills, and health promotion. I'm not going to read them all through, but we have gone through looking, and quite often, when you look at some of these, and again, I'm sure you will have done this yourselves, thinking about how do we actually teach some of these more abstract concepts to the medical students on the wards. Whereas getting them out there and engaging with the third sector, we're finding that we're definitely meeting these outcomes in a very different way.
And I'm quite happy to see on the call we've got 2 colleagues that work with us in the healthcare improvement team, Jane and Katie, here as well. So there is a wider team of us working on different bits of teaching that are all aligned under the healthcare improvement umbrella. And that these service learning or community engagement placements are just one part of that. But we also weave in these other themes as part of the teaching as well. So the students also learn about quality improvement, inequalities, realistic medicine, utilising design to improve healthcare as well. So I just wanted to make sure that I connected the dots to that kind of bigger picture as well. And this has given a bit of an idea of the kind of scale of things. Carolyn started off as a one-man band with this, with 4 students and 3 partner organisations, and over the years we've kind of grown the student groups, grown the organisations that we're working with, but also grown the team, because now there's 4 of us, which is lovely. We've got the projected numbers there as well for what this will look like in May 2026. So yeah, as well as the scope kind of growing and these numbers growing, I suppose our experience and knowledge around it is growing as well, and we're learning as we go. So how do we do it? What are the approaches to learning? So as Carolyn alluded to, the main structure is a service learning approach where the students are out in the middle of that balance beam. They're working with the organisation to deliver something they are learning. And this is some of the community partners that we've been working with over the last few years, and we're continuing to work with all of these partners as well. So we've got some fairly local to us in Dundee and some that are a little bit further afield. And they cover a whole range of different sort of topics and service users, some with very specific remits like Deaf Links, who are working with the deaf community in Dundee, Alzheimer's Scotland across the whole of Scotland, places like DVVA, which is the Dundee Volunteer and Voluntary Action, which have a much wider remit and support a huge diverse group of people with different needs around inclusion and social inequalities. And underpinning this, we've got our intended learning outcomes, and I'm not going to read these verbatim, but I'll probably just summarise a little bit. What we're trying to get across is this idea that health and well-being is multifaceted, and actually health is something that's not only tended to in a healthcare setting. That's a big part of the learning. There's a lot of reflection that happens in terms of their own role as a future doctor, but also the wider community's role in health and well-being, collaboration, teamwork with the different groups in the community setting, utilising design methodologies to understand the system that they're working in and make improvements, and I'll share some examples of that soon. And also that good academic practice of looking at the literature around this stuff, using that to inform their project so it's evidence-based. And also there's a good opportunity for them to develop awareness of working in a completely different environment. These students they used to be 2nd and 3rd year students. Going forward, they will all be 3rd year students, but they've spent a lot of time in lectures and in simulation and in classroom-based sessions, and then we're chucking them out into these community settings that are very different. And so there's a lot of learning to be had from that as well. And I've done a little bit of mapping to the wonderful core curriculum for sociology from the BeSST group, and reading that document even and thinking about what we're trying to get across in these placements, there's so much linkage, and I've pulled out some of the ones that I can see as being really key. That idea of understanding lived experience of people's health, illness, disability and healthcare, those links between individual experiences and social structures. These are all things that we explore over the 4 weeks. Thinking about social norms, stigma, values, emotional impact of living with illness. And again, the students are spending time with people as people. So they're getting to understand lived experiences of these different people within these different contexts. And as well as them going out and spending time within these organisations, we bring them together and we do a lot of reflection. I get to get my Lego kit out every time, which is a joy for me. I don't know how much the students enjoy it. Maybe I like it a little bit more, but we get them to reflect in and on action. So really thinking about what they're doing, what that means for them going forward. And I think we do find that over the course of the 4 weeks, their conceptualization of what happens within the community or what these groups can do does change, and there is often light bulb moments, which is lovely. And alongside that group reflection, there's also project support, so coaching the students through the project delivery of what they're doing. They're asked at the end of the placement to present a poster presentation on what they've done, so we support them to focus in on what they're doing, utilise their time well, make sure it's meeting the needs of the community. And really the fact that it's only 4-week placement, they've got to be quite concise with what they're going to try and achieve. So they're holding a lot of skills in time management and teamwork and workload management as well, which is beneficial too. We teach them to use some specific methods, and mainly we're using methods taken from the world of design to help them think about how do you make change that meets the needs of the people that you are serving. So we give them a kind of a range of tools to pick from, but it's mainly empathy maps, user personas, and ecosystem maps. We do a session with them on putting people at the centre of service design, where we talk to them about design principles and help them think about how they can use these tools to understand the system that they're working in. And there's a lot of discussion around realistic medicine and person-centred care that's woven through these sessions as well. I'm always really fascinated with how the students use these tools and how creative they get with them as well. I've taken a couple of screenshots of some of the examples. This was the one on the left-hand side here was a group of students that were working with deaf links, and they made a really insightful user persona about a specific group of people, so children of deaf adults, and actually the different barriers they come across. And so they're utilising these tools to help kind of understand the people that they're working with, and you do see them start to connect the dot with how they can use these tools in their clinical practice as well, which is lovely. We also really try and emphasise the learning around inequalities within this project. So we've got the students for 4 weeks. There's a lot of inequalities in action that they see within the services they're working in, but we also do deliver some specific teaching around this, building on some of the teaching around social and health inequalities they've already had in the earlier years of the curriculum, but they're now getting to see this in real life. They're seeing people that are living through inequalities and inequities in their health and well-being, and so actually they're able to really pin something on that, and you can see something that was quite abstract and academic becomes much more real, which we see as being a real benefit as well.
I think we had a look at this and made this slide where these placements are called student selected components here at Dundee, and it is a choice. They can choose to do something different for the 4 weeks, but historically a lot of them have still chosen either medical or surgical options because they think that that's more important or something. And, you know, my question, so why would I want to go and spend 4 weeks with a third sector organisation? As you'll see from the end, by the end, we do hopefully convince them of the benefits. But I think this also helps that, you know, as well as communication skills, which they get lots of opportunity to improve, these placements are all related to the different specialties that they do, you know, from ENT to oncology to psych and health education itself, research, obs and gynae. So I think this is just quite a nice slide that shows the breadth of the specialties that the placements are also relevant to. And going on from that, we mentioned right at the beginning that we do ask that between the students and the organisation they identify some sort of project, and these have been very, very wide-ranging. Quite a lot of it is informative, so maybe making either videos or posters or flyers that could go in healthcare settings, for example, GP surgeries or in clinics, that would act as signposts, both for the clinicians and the patients, so that they can see just what is out there to support people with different healthcare needs. They're also been involved in some research. Outside Scotland, they have their own research groups, and they're quite good at supporting people doing research projects, but they can be doing everything. You can see there from baking and sports. We had one group of students that did Scottish country dancing, and that was actually part of a small research project with Alzheimer's Scotland. And I think Jordan's going to show you some pictures that just illustrate some of the other projects.
I think one of the ones here to mention the service evaluation of Dundee Community Craft, which is a kind of a small social enterprise in Dundee that utilises jewellery making as a recovery tool for people suffering from different sorts of trauma and recovery from drug use as well. And the students were able to work with the women that were using the service, and they made a really nice little vignette video that showed how this kind of trauma-informed approach to jewellery making was building these women's confidence and opening up doors for them in their recovery going forward. The students weren't videographers before they went in, but they became incredible documentary filmmakers when they kind of got involved in this bit of work. And this was also an example of some lino cut printmaking classes that some of the students delivered in a centre just outside Stirling, is that right? Where they went into, it was a kind of cross between a care home facility and a rehab facility, where a lot of the time I think the residents were quite bored and twiddling their thumbs, and the students got involved with a local artist from the art school at the University of Dundee, and were able to take these art classes and deliver them for the people within that residential home. So yeah, some of the stuff they come up with as well, it's nice to see the students getting involved in very creative tasks. I think that's the other sort of side intended learning outcome that is beneficial, but it's real hands-on stuff working alongside people as well. There's always got to be assessment when we're doing learning, probably not Carolyn and I's favourite part of this, but the students do present a poster on what they've done. They talk about the stakeholders they've engaged with, the methods they've used, how they've engaged with people, and reflections on their learning. They also write a reflective report, which are mostly a joy to read. There's some really nice light bulb moments that come out of that writing. They're also assessed on their motivation and engagement, and that's just alongside all of these student selected components in Dundee. That's kind of the structured assessment. And they get a lot of feedback from the partner organisation as well, who are the ones that have spent most time with them. Carolyn and I will see them for a few hours a week, but they're spending most of their time in the community. And we do make sure that we share that assessment up front with the students so they know what they're going to be getting assessed on. And I suppose the final part of this is why we do it the way that we do, and we're just going to share some of the evaluation quotes. So I'll hand over to Carolyn for the first lot of student quotes.
I think, conversations that Jordan and I have had with people about being involved with these placements, we would both say that we both do a lot of teaching in different guises across the medical school, but this is the most transformational teaching that we do. When we see the students at the beginning, very much rabbit in the headlights, going to an area that's outside of the medical school, meeting with people that they haven't met, taking time to be with the people of Dundee on their terms, rather than when they are presenting themselves in this role of patient. And when we see the students at the beginning and then we see them at the end, there is no doubt there has been a change. And a change in understanding of where they are coming from. And I think, again, going back to the sort of teaching sociology and teaching some of these themes, they are very obviously highly intelligent group of people, which when you talk to them about it in a classroom situation, they're very much, well, that's obvious. But it's very different when they actually meet people. And I think some of these quotes just sort of help emphasize that. One here that we've used a few times is this: I've only completed 2 years of my medical school journey, and I already feel so jaded about it compared to 16, 17-year-old me working my absolute hardest on my personal statement in UCAT. I was so passionate, and I think somewhere across the last 2 years, I started to lose that spark. During this SSC with positive steps, has started to relight that fire, that passion I have for being a doctor who cares and works hard to understand my patients. I think interacting with such valuable and talented staff members and seeing that's the positive steps people, not being sort of seeing how genuinely excited and invested in us was really powerful.
And I think alongside getting some of that student feedback, we also make sure we work closely with the partner organisations to make sure that we need them to be getting something out of this. It's not just about them doing us a favour and taking the students, it's about how does this benefit them going forward. And I think within this quote here from one of our partners, Live Active, they're saying that the staff are benefiting from getting to engage with medical students and maybe getting a bit of understanding of how physical activity is perceived by medical professionals, because this is Live Active are a group that support people with things like one-to-one coaching to use physical activity to benefit their health. So this organisation are benefiting from understanding what are students being taught about this and how do they conceptualise this and what does that mean for our practice. And again, they've mentioned the fact that because the student projects deliver something tangible that then can be used after the 4 weeks are up, there's a sustainability built in there. And I think they were alluding to a promotional video that the students had made. Again, I think we're turning all these doctors into videographers, which is wonderful. So yeah, and they're able to use these internally and externally for promotion of their service, which they really valued. Another quote here from Positive Steps. And I think they get a real sense of accomplishment from getting the students into this very community-based, trauma-informed culture. And I think they can see how the students pick up on that and how the role modelling within the organisation has an impact on the students. And then whenever we speak to this team in particular, they say if we can just chip away and know that doctors know about this stuff that we're doing within the community to be compassionate and to help people where they are, even if we just get a handful of doctors knowing this stuff, they're going to get a real benefit from that as a community group, which is, yeah, pretty powerful when you see it like that as well.
I think, just before we go on to this, just emphasising again that we too, as individuals, have also had our eyes opened, just connecting with all these different third sector organisations and this increasing awareness of the incredible work that so many people are doing and supporting people in their sort of healthcare journey in a way that as a clinician it's impossible to do. And just... we then want to share that passion with the clinicians of the future to help them realise that that's not necessarily our job. We have a very specific job and that's fine, but our job the outcomes of that will only be successful if we think about the much wider picture. And while we can do that academically, if you've actually been out there and met some of these people, experience what the volunteers and more structured organisations do to support people in their health, walking hand in hand with them and working hand in hand in them, will surely have a much bigger impact on people's health outcomes in the long run, rather than as both working, as two completely separate entities. These are, apart from just doing these projects as a result of this, we've had students come who want to do BMSC and have done some research on this. We've had people do summer scholarships who've helped us to develop the programme. There's now a social prescribing committee, is that what they call themselves? Society for Dundee Medical School, which is huge, and they are encouraging students to volunteer across the city. Obviously, we've built up these relationships with the different third sector organisations, and also that has built its own momentum. That we hear one person in an organisation, the organisations are much better at working together. And so we get a message from somebody saying, oh, we heard that medical students have gone there. Why can't we have medical students? And we want to show them what they do. And so that is really how it has been growing. We haven't had to go out looking for them. And one of the newer things, which is maybe a bit strange in a way, but it has opened doors to work much more collaboratively with the dental school. And we've got a few projects, the English speakers of other languages that we're looking at working there much more with the dental school. The dental school have something called Dundee Dental Connect, which is a big community engagement project, and they go to the food banks and do oral health education, and we're looking at working more with them to do more general health education.
And I think whenever we talk about the other outcomes, I've always got to bring it back to me selfishly that this fills my cup, this type of work. And I think I had got involved in this at a time where we'd come out of COVID lockdown, but I was still working from home a lot in my normal day job. And so picking up something like this, seeing that transformative learning with the students and connecting more with other things that are happening in Dundee, just sort of sparked joy for me, and I think for Carolyn as well. And when you're getting annoyed at the other niggly bits of your job that you're not enjoying so much, I think seeing the students actually learn this really important stuff is very rewarding. So that's how we sell it. So we're really glad that we've got 2 more people join the team. We've managed to convince them that this is a good thing to do. Next steps, we'll continue to develop these projects. I think every time we deliver it, we'll do something slightly different. We're always tweaking it based on our student and partner feedback. We'll keep encouraging and leaving those open doors for new organisations to be involved, and we're hoping to continue with some research opportunities to evaluate the benefits and pitfalls of these placements and share it a bit wider as well. As Carolyn alluded to, a lot of the literature around this is based in America. But actually we've got quite a few years worth of data now that we're hoping to be able to share. This is what we always like to leave as our take-home messages for the students, and we thought we'd share this with you as well today. So it's a real privilege seeing patients in non-clinical settings in their own context, and really you're getting this new depth of understanding of what it actually means to be person-centred. The on-the-ground reality of inequalities is very different to what that looks like in sets of statistics on a slide. And really the third sector and these community groups are invaluable in the role that they can give to the community, not just in terms of what they do for the people, of tending to their health and well-being, but also the way that they work in teams and look after each other, and what the students learn from the culture of these organisations, which can be very different to the culture within NHS teams. And we like to talk about the fact there's more to Dundee than the university and Tesco's, because that's mainly what they tend to see. They'll go to their classes, they'll go to the big Tesco and the Students' Union, but actually there's so much more going on in this city. So this was just something to summarise. So the student, what would you tell a student considering this SSC? So the student had said it's an extremely valuable lesson that will teach you things nothing already in your course could teach you. You'll gain a lot of confidence, independence and creativity through this SSC, and for the work and effort that is put into it, you get tenfold back for the learning and experience you gain. Which again, that just keeps us going when we get to see that. So, and we're just happy to take any questions or comments or any kind of conversational topics that link to this. But thank you very much for listening.
Thank you.
Thank you so much. That was just brilliant. I think a tonic for an afternoon to hear such positivity. I think, and coming from Dundee, it's always a joy to hear about really good projects from Dundee as well. So I have loads of questions, but I'm not going to monopolise this. And I see Ingrid was right in there. So Ingrid, over to you first.
Yeah, thank you for the presentation. It's really nice to hear people feeling so positive about teaching. It's especially as we head into the depths of November, I think. I know we're not there yet, but I had a quick question, and I feel like Helen and my question might be similar, so I'll try and be focused. We run similar kind of sorts of things in Edinburgh where students kind of do stakeholder engagement, and a lot of that work is calling in favours with research partners that I've worked with third sector kind of folks. And I'm very aware of how much I ask of my research partners and folks that I know, and the time that it takes to spend with these students. They don't the students I'm talking about don't do placements in the way that you're talking about. But I wonder if you can speak a little bit to the capacity that third sector has to support these placements, and if there are any funds that Dundee makes available to third sector partners, if third sector partners actually what they gain out of it, that if kind of it's kind of they don't get funds but they get something out of it. I wonder if you could speak a little bit to the kind of what third sector kind of what they think of this, and any maybe challenges that you've managed to overcome. Thanks.
We'll start. There's no funds. I think it's mainly across all the Scottish newspapers and beyond, isn't it? That Dundee has no money, so there's definitely no funds. So from that point of view, it is very much goodwill. But having said that, I would say that the partners really do feel that they gain something from having the students. I mean, we do always, like we've alluded to, ask them to identify a project that will give them something back. Sometimes it is research, sometimes the research is around helping them write for grant proposals. But a lot of it is really just raising awareness. But the organisations, we've hardly had anybody drop out. The organisations very much see it as an opportunity to influence doctors of the future. And they see that as a positive thing, thankfully. And so they are very happy to work with us. We've tried to keep it very personal. And so it's great that Jane and Katie have come on board with us, because it's, the last year it has got a wee bit big for myself and Jordan to keep that personal contact, to be able to visit them. Usually buy them a box of chocolates, but that's about all. But just trying to keep that conversation going with them and to really be thinking about, how is this helping you? And very much focusing on the idea that these students will know that you are out there, and hopefully going forward that will make a difference. If you want to add to that.
No, I think that covers it. The only other thing is that, so we might have, say, 2 students placed with positive steps, but we'll have 30 students in total, and they all learn about positive steps through the 2 students that are there. So actually you get 30 students learning about these different groups, and then having that in their head when they're on placement and they think, oh, there's that person, and actually they could do with some harm reduction leaflets. I remember my colleagues made those leaflets. So you get that kind of, but yeah, a lot of it is goodwill, the kind of greater good. But they seem to be keeping going with us.
Thanks.
Thanks, it's really helpful. The financial issue is always a tricky one. I think we get a little bit, Ingrid and Helen and I have had this conversation a lot, get a bit frustrated with the funding streams that are set up. So the ACT funding that will fund NHS teaching and GP teaching, but this is just assumed in some way that third sector organisations will be able to support. And I know that there are definite benefits, and it sounds like you're working it in a way that that's really a core part of it. But I think the inability or unwillingness even to consider that this might need financial support as well can get a little bit frustrating at times. So maybe this is something we can all collectively try and push for. So not a good time to push it for more money though, I guess, but we'll see. Helen.
Yeah, sorry, I'm really noisy, so somewhere really noisy, so I hope you can hear me. But I think I was just thinking, I wrote down loads of questions. I think you've just answered most of them. So I was going to say something similar to Ingrid, but partly I was wanting to know if you always found something that students can genuinely contribute, and I think you've just answered that, because I think finding a project, and I was going to ask how many in each group, but I think you've answered that, like you might place 2 with each. And I'm really just super impressed that you've got loads of staff to help with this, because I know how, I mean, you know, as ours is very different. In the first year, we send ours, you know, all 300 of them out, but to lots of different ones, but only for an hour, you know. And so I don't know, this is like a dream what you're doing. I want to do it now. But I think so what I'm just so I think you've answered most of my questions, but there had two more. What proportion of students, because you said there's about 40, so what proportions of the year choose to do it? And is it 4 weeks full time as well? I think that's all my questions.
Yeah, so it is 4 weeks full time. And however, we do say to the partner organisations, you don't need to fill 40 hours worth of placement. The students between self-directed learning coming into Nine Wells to do some reflective groups and project check-ins, they're not there the whole time, but they do end up with very full timetables. At the moment, in terms of proportion, there's a bit of a move happening at the moment. We will, as of 2027, have every student in the Dundee MBCHB curriculum will do a healthcare improvement student selected component, most of them being underpinned in some way by a service learning approach. They'll not all be based in the community, but they'll all follow a very similar structure. So we are moving to all of them. But as of this year, did we have 60 students out of the 220 odd in a year do one of these placements? But really, the school is strategically prioritising this and want all students to do it eventually, which is why we've got more people in the team, and we're trying to scale it up but still keep the bits that need the small scale, like the partner organisation liaison and the project coaching, which does need quite kind of hands-on small group stuff. Does that answer your question, Helen?
Yeah, I think so. Yeah, because then I'm assuming then you have like members of your team meet with the group to help guide them during that 4 weeks as well. So that's where the team are coming in. Yeah, I probably have loads of questions I want to email you about afterwards. So
that's perfectly fine.
But it's great. Thank you.
I think just another comment with the upscaling, because again, going back to this, it has been student selected. So we probably have had that cohort of students who are more socially aware and are quite happy to go and do something like this. Now, with the medical school deciding this will be good for everybody, we are going to have people who would actually rather be spending their 4 weeks doing neurosurgery. And I think that in itself will be interesting. You know, just seeing how they engage and also their comments at the end, you know, whether we see the learning in the same way and the sort of eye-opening experience in the same way from individuals who, you know, are understandably different and are probably going to have a different role in the medical profession, which is fine. But it will be interesting having a bit more of a mix of personalities.
Just before I go to Hannah, can I just clarify about the 4 week? Is that the whole thing, the whole SSC is a 4 week block, or do they have kind of wrap around and it's just the placement is 4 weeks within a longer period?
The whole thing is 4 weeks. So they go from being in one part of the curriculum to 4 weeks and then go back into the next part of the curriculum.
Okay, brilliant. Thank you. Hannah.
Yeah, thank you so much for this presentation. It's massively inspiring. And I mean, it gets me planning for next year because I want to do something similar. And I also want to highlight how much I loved your point about it refilling your own cups, because I think we really have to think more about sustainable teaching and sustainability of us as teachers. I don't think I have to explain more, but it's such a valid point. And it might also, I mean, not only that we are better teachers when we're enthusiastic, but it also then is mirrored in the healthcare service, right, where staff are burning out and where I think, you know, similar things are needed to improve the experience. Anyway, it made me think about how I could integrate something similar, community engagement experience in a medical anthropology elective course that I run here at Edinburgh. And I was thinking through practicalities. Did you have to do any kind of health and safety assessment, risk assessment, or something like that when you sent the students into community? Or was that not needed?
Yeah. I mean, it's something that we check. I mean, all of these organisations have got their own health and risk assessments and fire plans, and we essentially just ask them to say that they've got them. So the ScotGem programme, they have, what do they call their programme? They do something similar, and they've had it embedded in the programme from the beginning when ScotGem started, but theirs is much more longitudinal. So they do it over a period of something like 10 weeks, and it is a little bit more like volunteering than the more sort of concentrated 4-week placement that we do. But we use their expertise on all of this. And when they send the students out, they have this 3-way agreement. They ask the student, the organisation and the medical school essentially to sign. And we still do that, and that covers a lot of this.
Yeah, so part of that is the organisation saying that they will make sure all the correct health and safety procedures are followed and be responsible for that part of it. We'll make sure we're responsible for supporting the student pastorally through the experience. So we do have this kind of backup plan with a bit of governance around it. But yeah, that so far, touch wood, that's not wood, it's plastic, but has seemed to have worked fine.
Thank you.
So it's a good question, though. We kind of always looked at what are the practical issues that you need to navigate, and obviously you're trailblazing in this, so we'll just follow in your way because you resolve all the problems, which is great. One, I don't know how many of the groups it would apply to, but whether you need to handle PVG as well. I know that they've changed the processes around that. I'm now a trustee for a charity, and that they were talking about the barriers that has now caused in terms of recruiting volunteers, because they're a tiny charity, and it's just so burdensome for them to actually go through that process with large numbers of volunteers. It stopped them scaling up, and I don't know if that's something, or it's not. You don't need that for many of the groups that you're working with.
We do need it for quite a few of them, and I think we're having to adapt the system a little bit this year because the PVG scheme has got a little bit tighter. All of our students, by the time they get to this placement, have got their PVG with the medical school. So we're hoping that what it's going to look like going forward is that it'll be a lot quicker just to get it updated for them to have this other organisation listed on their PVG. But I think we will have to, going forward, have some of that done before the 4 weeks starts. So have a little bit of paperwork exchange in the background. So it will mean another administrative process, but we're hoping if we get it set up, it'll work. Again, so far, I think prior to the changes to the PVG scheme, it was all just sort of like, that's fine, they've got PVG to the medical school, it's fine. Whereas now the third sector organisations, rightly so, are saying, no, we need to do this absolutely by the book. That we'll build in processes for that and hope that we're at the moment pretty cautiously optimistic it's not going to cause any barriers.
Yeah, okay, it's fantastic. If there's nobody else jumping in, I wonder, so we are kind of thinking about this for as part of a new BMed SCI, so a third year they would be doing an intercalated programme that we're hoping to develop, and a core part of that would be some kind of community placement, whether it's a course, a 20 credit component within it. But we have the potential to make it a bit longer than 4 weeks. So if it was a course that ran for a whole semester, then it's potentially a 12-week period. So I wondered what you thought if you had a 12-week period, and the students had say roughly a third of their time. So if they do 20 credit courses in a semester, would you think it would be better to do that still like a concentrated block of community placement time, or a little bit more part-time spread out, scaffolded with other learning, other activities? What would, I mean, that's kind of putting you on the spot, but do you think having longer is, you would do it differently?
What do you think? So do you mean over the 12 weeks, would you have one part of that when they're in the organisation and then another part doing something else?
Yeah, so whether it's kind of doing sort of teaching around it, getting them to think about certain things, then they go away and do a placement for a focused period of time, and that's all they're doing, and that's the kind of full-time bit, and then they come back and do something else, or whether actually having them less time but over longer period within the organisation would work better.
I think, I mean, in part it would be up to the organisation whether or not they could cope with having the students over a prolonged period of time. I mean, I think that in some ways is one of the advantages, that they know some of the organisations, we offer the placements in January and May. Some organisations have students for both, and some just do the May block. And I think for some of them that suits them, just to, you know, that's 4 weeks in the year when they're going to have the medical students, everybody's on board with it, and you can keep the momentum up for 4 weeks. Having said which, I think there would be pros of doing it over the 12 weeks. Because the students also feel like, you know, they're just like with Alzheimer's Scotland, they get to know the group, and then they lead a group or organise some sort of craft activity, and they do it, they get really excited about it, and then they've gone. Whereas they'd be able to do that a little bit more, you know, continually, and grow with the group a bit more. I think the danger is always that then it becomes volunteering. And, you know, they sort of think, oh, well, this is my 4 hours this week when I've got to go to the centre and volunteer, and I'll do this, and then I'll come away. And I think one of the things that I'm, you know, very sort of focused on is keeping that relevance to medicine. So, you know, keeping it the whole time linked up to that actually you are going to be a clinician. So, you know, why is this relevant to who I am as a clinician? It's not just I'm giving 4 weeks of my time in this block to go and volunteer and help them out a bit. And I think that's easier to do when it's concentrated. I think one of the advantages of the 12-week is that, you know, we have had our eyes open to loads of research possibilities, and it's just not possible to sort it all out in 4 weeks, you know, to get the ethics, to get the questionnaires or whatever out there. But I think there's huge scope, and the 12 weeks would definitely give you more time for that.
I don't think it would work in 12 weeks either. So, yeah, no, but that's really helpful. I think that's really useful. I think it's, I can't, we haven't discussed this, but I don't think it would be all 12 weeks, but it's whether you could expand it a bit, and even whether it's full time but slightly longer, or slightly thinner and longer, but still quite chunky. Because I get your point that if you reduce it too much, it just becomes about, oh, what are they doing for like half a day a week over that period of time or something. So that's really helpful. Anyone got any other questions? Hannah?
Yeah, sorry, just briefly, because I kept wondering if there is any scope for asking the students to write field notes, like type, you know, ethnographic or autoethnographic field notes, which would also make it a bit different from volunteering as a kind of mini research project for them. And then I would be really interested in their field notes and the experiences. So there could be like a little meta research maybe to document what do students observe, what do they think is relevant learning on these placements, and what do they take away from it, to kind of to document this, as you call it, transformational process. So I don't know. I would love to think more about that.
I think one of the things that we did have was a summer vacation scholarship student worked with us to develop a reflective diary that the students would use throughout their whole but we've been careful to make it very personal to them, and that we don't need to see it. That it's about their jotting down their learning to help them process it, then to utilise aspects of that in the reflective report at the end. But yeah, we have kind of thought about, and a lot of when we read the reflective reports at the end, you often think, oh, I kind of wish I could publish what they've put into these reports, because it's so interesting to see how they've made sense of quite a challenging situation, and very, like, they're really socially anxious at the start of these blocks. I think they come into it really quite terrified about going into a different situation, and where you read how they've made sense of it. So yeah, no, I think there'd be scope to do some really interesting stuff. I think we're always trying to hold ourselves back because we've also got 1 day a week on this. So it's like trying to fit this into all the other stuff that we're doing as well. But there's loads of potential.
Yes, I mean, I think what you're speaking about is, you know, we've spoken about that right from the beginning. How could we capture this? And with the BMSE students that we had, they tried to do it a little bit, but they were also sort of just learning research methods as well. And, you know, it's just a tiny drop in the ocean. But, you know, like you're saying, keeping those sorts of notes and analysing them in a clever way, something that's far beyond me, I think would be really interesting. Yeah, and then again, you know, as you have more and more students doing this, trying to revisit it in a few years' time when they are actually practicing.
Well, yeah.
Yeah. I guess that's the beauty of it. I'm going to wrap up because we're at time. That there's loads of different ways that it could be done. And Hannah, you're an anthropologist, so if you're doing an anthropology version or embedding this in some way in your anthropology course, then maybe the field notes would be a core part of that, and that would be part of the anthropology learning as well. So anyway, thank you so much. This has been really, really interesting. I'm sure there'll be lots of other people that will watch the recording and want to hear more about it. And for anybody that's joining a BeSST show and tell for the first time as well, if you're not already on the mailing list and you want to be on the mailing list and come to more of our events or find out more about BeSST, then just drop me a line and I can just add you to that as well. Happy to do that. So thanks everybody.
Thank you very much.
Thank you. See you later.
Thank you.